Hi friends, I wanted to pop on here real quick and do an update to the video I made about 4 or 5 weeks ago on my journey with acid reflux and GERD. I got a bunch of people from a variety of different platforms tell me that this was some of the most relatable content I've ever made and that I need to do some kind of update. And before I get into anything, I've got to tell you that I'm not a medical doctor and anything I'm going to advise here is not medically board certified, et cetera, et cetera, et cetera. So proceed at your own risk. You can't hold me liable. But if you go back and look at part one of this, I provided a bunch of different products that I found on Amazon to help treat the condition. And they all worked really, really well at calming down the pain that I was feeling in the upper gastrointestinal tract, behind the breastbone, et cetera, et cetera. So I've been pain-free for a while. And so I still stand by all those products. Something that was still lingering was abdominal pressure. It felt like there were, for lack of a better way of putting it, it felt like there were fumes that were migrating up. And it felt like there was something that was forcing open that LES. And I thought about it, and I thought about it, and I thought about it. And I was like, I think this is a byproduct of bacteria. And I did some research on SIBO, small intestinal bacterial overgrowth, and I have diagnosed myself. I have not done the different blow tests that you're supposed to do, but I just sort of gave it a try to treat it with home remedies that I thought would be aligned with that diagnosis. And part of the reason why I felt like that was the right path to go was one of the products I recommended in the first video was this Old Amish digestion tonic. And I was responding really, really well to this. And the ingredients in the Old Amish tonic are organic apple cider vinegar, ginger juice, and garlic juice. And I was like, why am I responding so well to this? I remember early on in my acid reflux and GERD journey, all the naturopath doctors were saying, oh, counter to established advice, it's not that we have too much stomach acid that needs to be controlled with PPIs. We actually have too little, and you need to increase the acidity of your stomach. And I put all these different data points together, and I thought, you know what? This would make sense if I have turned my body into some sort of chemistry set as the result of using antacids and acids, et cetera, et cetera. It would seem to create the right environment that SIBO could occur in if the acidity wasn't great enough that it could be eaten away by my own stomach acid. The only thing that really gave me pause about this conclusion is that very early on in trying to treat my acid reflux and GERD, I did try to use things like apple cider vinegar and betaine HCl. And at that point, I remember feeling a profound burning, an irritation, and I wanted it to work, but it was actually counteracting its effectiveness. And now, having been in this for 5 or 6 months, it seems like it was the wrong treatment at that time. I think my esophagus was irritated by the stomach acid so much that me trying to cure it by making it more acidic was only aggravating things more. So the products I recommended in the first part of the video, I think are necessary in order to calm it down. And now the stage that I'm in, I think we can start to add in the acidity and make things better. And that's what I'm experiencing in my real life. So I'm going to share those. What I'm doing now is before every meal, I either, and before I go to bed at night, I drink like 2 tablespoons of apple cider vinegar mixed with water through a straw, or I use, you can do this in pill form. I think the pill form has some benefits to it because it's not as harsh on the enamel of your teeth if you're concerned about that. I also mentioned I'm taking about 4 of the HCl, betaine HCl, pepsin, and gentian bitters. All right, these are digestive enzymes that help get things going. I found some relief with bile salts as well. I actually went and I bought Dr. Berg's gallbladder formula. There's probably a lot of you out there who know who Dr. Berg is, either through intermittent fasting or a variety of other treatments. And I would highly recommend you consulting him about this treatment methodology rather than me. I'm just kind of pointing you some directions on a personal solution that is working for me. And more recently, I can't really testify to its effectiveness of it, but I've been using this allibiotic CF as like kind of a natural antibiotic to get rid of any sort of negative bacteria that we don't want down there. And I seem to be tolerating it rather well. To be honest, this is the best I've felt since the condition manifested itself back in July. I think the answer for me at this stage, and there are different solutions at different stages, is going to primarily be apple cider vinegar and the what did I say it was? Betaine HCl pepsin. So it's really just a question of now getting the acidity of my gut correct until I don't need these things at all. I still stand by the products I recommended in part 1, but they've served their purpose, and this is what I'm on to now. And I don't know, maybe in a few weeks I won't need any of this, but I wanted to share that update. I know I have a lot of new subscribers. I don't know if you think that my channel is a health channel or my channel is about Stanley Kubrick or Carl Jung or literature or philosophy. I'm figuring it out. Stay tuned. I plan on doing more health videos that are relevant to the things that I've experienced. I don't set myself up as some sort of health practitioner. I'm just going to be offering advice that's helped me. Some of the things I want to address are in future videos. Something I've struggled with my entire life is insomnia. I really want to attack that in the new year. I want to share my experiences with mental health as well and help people out there. So yeah, those are probably, whatever I'm dealing with, I will make those resources available. And I have a book project that I've been working on in the background, and I'm starting to share some of that research. Right now, I'm doing a video on Jung and Stanley Kubrick. I think it's probably going to be 2, 3, 4, or 5 of these because the material is so voluminous. But I'm not going to be talking about Jung forever. There are other thinkers that I want to talk about as well. So just stay tuned. Subscribe, hope this helps somebody out there. And let me know if you've been where I've been and what the next steps are. Feel free to talk about solutions in the comments. And feel free to correct me as well. I certainly don't know everything. I'm just a guy trying to figure things out. All right, take care.